The largest supplier of blood in Minnesota and western Wisconsin says it needs you to donate. The Red Cross is telling us it has a stable supply but needs more. You see, the supply of donated blood is heavily influenced by outside forces, like the snowstorm we had on Tuesday. That meant a lot of people canceled their donation times, but more folks may be able to do that soon because there's news tonight. The FDA may change a controversial rule. Heidi joins us now to explain.
Jana, the FDA told me today they are reviewing results from a study with the idea of shifting away from blanket limitations and instead focusing on individual risk in donor screening. If they did that, more people could give blood.
In the beginning of the year, the American Red Cross said it was experiencing its worst blood shortage in over a decade. But for many gay or bisexual men, even if they want to help, they can't.
As somebody who identifies as a gay man, I'm aware of the policy that I don't think many people realize is that most gay men cannot donate blood.
Christopher Johns is a fourth-year medical student at the U of M who researches transfusion-related policies that target men who have sex with men. Starting in the 1980s during the HIV/AIDS crisis, the FDA placed a lifetime ban on blood donations from men who have sex with men. That changed in 2015 to allow donations from gay men if they didn't have sex for an entire year. Then in 2020, with severe blood shortages during the pandemic, the FDA shortened the abstinence period to 3 months.
Going into med school, I was aware of this policy, but I didn't really understand the medicine behind it or why that was the case, why we were being barred from that. As I eventually learned more and began my studies, I really recognized there were certain problems with the system and discovering that this wasn't necessarily medically sound.
Christopher's research found that the shift from 12 months to 3 didn't change anything. Gay men didn't rush to donate, but 9 out of 10 of them surveyed said they would donate if they could do so immediately.
The other thing that was interesting is that the majority of people who were surveyed who did donate blood did so against deferral guidelines, meaning that they did so within that deferral period they had sex. Which shows that these guidelines aren't actually stopping a lot of these men from donating blood.
The FDA is now considering instead a questionnaire based on individual risk assessment. And for safety reasons, donated blood already gets tested for infectious diseases.
It does point to a bigger question, which is going around these discussions, is it actually ethical, these deferral policies? Especially when you look at certain populations of gay men, such as those who are in monogamous relationships, who are those who are using medication to prevent STDs and STIs. As a gay man myself, I'm really excited for there to be a time when I'm able to actually donate.
Back in March, Minnesota joined other state health departments in signing a letter to the FDA commissioner calling for the deferral policy to end. It said there's no credible evidence that it improves the safety of the nation's blood donation supply, calling it ineffective, unnecessary, and discriminatory. The FDA says it anticipates updating its guidance in the coming months. Jana.
I learned a lot in that. Thank you so much, Heidi.